Today we are going to talk about common suture materials in dogs and cats. But instead of just memorizing names, think about when you would actually choose one material over another. Monocryl, or polypropylene 25, is an absorbable monofilament suture. I would pick monocryl for tissues that heal fairly quickly and do not need long-term strength. For example, I might use it for subcutaneous tissue, buried intradermal skin closure, or small soft tissue closures where the tension is low. It is smooth, causes low tissue drag, and is nice when you want the suture to disappear without needing removal. I would not choose monocryl for the linea alba or a high-tension body wall closure because it loses strength too quickly. Vicryl, or polygalactin 910, is an absorbable braided multifilament suture. I would choose Vicryl when I want something easy to handle with good knot security in a clean surgical field. For example, it can be useful for ligating vessels, closing some muscle layers, or closing subcutaneous tissue in a clean spay or neuter. But I would avoid Vicryl in a contaminated bite wound, abscess, urinary bladder closure, or intestinal surgery because braided suture can trap bacteria and wick fluid. PDS, or polydioxanone, is an absorbable monofilament suture that lasts much longer. This is the type of suture I would think about for the linea alba after an abdominal surgery, body wall closure, fascia, or places where failure would be a big problem. For example, after an exploratory laparotomy in a dog, I would much rather close the linea alba with PDS than monocryl because fascia needs longer support. PDS is also useful for some gastrointestinal and urinary surgeries because it is monofilament and absorbable. Maxon, or polyglycinate, is another long-lasting absorbable monofilament suture. I would think of Maxon similarly to PDS. It is useful for body wall closure, fascia, and tissues that need longer-lasting support. So if I am closing an abdominal wall incision or a high-tension deep layer, Maxon or PDS makes more sense than a short-lasting suture like monocryl. For the urinary bladder, I would usually prefer an absorbable monofilament suture, such as PDS or monocryl, depending on surgeon preference and the case. The bladder heals relatively quickly, but the suture is exposed to urine, so you generally do not want nonabsorbable suture inside the bladder because it can act as a nidus for stone formation. I would also avoid braided material in the bladder because it can wick fluid and bacteria. For intestines, I would usually choose an absorbable monofilament suture, often PDS or a similar material. The intestinal lumen is contaminated, so monofilament is preferred over braided suture. I would not reach for silk or braided Vicryl as my first choice for intestinal closure because infection and wicking are concerns. For skin, I would often choose nylon or polypropylene. These are non-absorbable monofilament sutures, so they are useful when the suture can be removed later. For example, after a routine skin incision, nylon skin sutures may be removed in about 10 to 14 days, depending on the location, tension, and healing. If I want a buried cosmetic skin closure instead, I may use monocryl intradermally so there are no external sutures to remove. For contaminated wounds, like bite wounds, draining wounds, abscess repairs, or dirty lacerations, I would avoid braided suture when possible. A monofilament material is usually better because it is less likely to trap bacteria. Also, not every wound should be closed right away. If the wound is too infected or dirty, it may need drainage or open wound management instead. For tendons, ligaments, or orthopedic-type repairs, I would think about non-absorbable or very long-lasting suture because these tissues need prolonged support and are under tension. This is different from subcutaneous tissue, which heals faster and does not need the same strength. So the practical rule is this: monocryl is good for low-tension, fast-healing soft tissue. Vicryl is useful in clean tissues when handling and knot security matter. PDS or Maxon are better for fascia, body wall, and deeper closures that need longer support. Nylon or polypropylene are common for skin. In contaminated areas, urinary tissue, or intestinal surgery, monofilament is usually preferred over braided suture.